Hello, everyone. Hope this session today finds everyone well. I ventured out from my COVID isolation and I'm back in my office this morning and on campus. We'll see how that goes for a little while. But today we're going to be doing Chapter 6 in Loosening the Grip, a handbook of alcohol information by Gene Kinney. Y'all know the work. And so I'm going to go ahead and do a couple of things. One, in week 8, I'm going to be posting a link for you to do an evaluation for this course, and it will be assignment, and it will be worth 10 points. And it's an assignment, so if you don't do it, it's minus 10 points too. So there's not extra credit. So be advised of that, and I want to encourage you to do that. Because we need those things. When you do an evaluation, I read it and I look at the data and I pay attention to it and I see what we could do, what we may have fallen short in, what we could do better, what you think about it. And what you think about it is important to Lee College, and it's important to me because I want to do a good job with you and for you. So let me know. That said, I'm going to move over and we're going to go to, I'm going to share my book with you. Instead of a PowerPoint today, we're going to be doing a book. I don't think you can see that though. Hang on just a minute. And let me see. No, I didn't give that to you. I just clicked on it. Now that should be better. Okay. Medical complications. This is kind of a big topic here, guys. Alcohol use disorders, and this is important, are one of the most common chronic diseases in the United States. Oh, by the way, when I said no PowerPoint on this, there's no PowerPoint on this yet. I'll put you one in there as soon as I get it spiffed up. But the prevalence is around 9% in the population at large. People who drink are sick because they drink, but because they drink, not along with being a drinker, but because they drink. They have alcohol-related illnesses. And alcohol, alcohol dependency, alcohol use disorder, as we've already discussed, is in itself, at least in the more severe forms, an illness also. And there's a lot of physical consequences that result because of drinking, whether we like them or not. I like this little thing here with this guy. It starts up here with number 1, and this is his little thought bubble. That's what that's called, right? Thought bubble. Anyway, he's got a thought bubble. And in that thought bubble, he sees himself as kind of a BMOC, big man on campus, right? He's, just a fun-loving, cool kind of guy. He likes to party, and he drinks a lot, but he can control it, right? He can take it or leave it. It doesn't, besides, it's his body. What business is it of anyone what he puts in it, right? So anyway, that's his image of himself. Our image over here is moving from top to bottom. Is that top one is a distorted self-image. He sees himself as something he's not. 2, he's got a bulbous enlarged nose. That's called rhinophyma, and it may have burst capillaries in it, so it's kind of red. That's why we get depiction of drunks as having red noses, and they do have red noses, but they also have red cheeks and red jowls, and some of us splotch all over our bodies when we drink because of alcohol's effect on the skin and pigmentation and what have you. But the bulbous enlarged nose, and that's because alcohol makes your nose bigger. Sorry, Pinocchio, it's not dishonesty. It's alcohol. Number 3 is sallow or jaundiced skin. Sallow skin is skin that's got a unnatural hue to it. If you've been around, if you've been in the bars much at all, and I'm not asking for a show of hands, of course, you may have seen people, white people I might add, who have sallow skin. Skin changes occur with darker people, with black people, but you see it more pronouncedly in lighter skinned people, Asians and Caucasians and that kind of thing. And with Caucasians the most. And it's kind of got a gray color to it. It's an unnatural, unhealthy looking color. It's the face of a barfly. And there you can see dilated capillaries, spider angiomas, which look like little cracks in a windshield where the blood vessels are up, look like a spider web. Scabbing, pustules, that kind of thing on the skin. As I said, darker skinned people have this too, but it's much more pronounced in white people. You can tell the yellow skin on a white person where you might not be able to tell the jaundice changes in an African American skin. You will be able to tell it in their eyes, though. Black people have a tough time with that because it looks like two Tweety birds parked in the middle of their face, and you can see them coming around the corner. And you got a voice kind of like this. Used to call it a whiskey voice. Cheech and Chong made fun of it on tapes and things like that, the wino sound. Jimmy Gilmer and the Fireballs made a song with it. A bottle of wine, fruit of the vine. That one. So you have a whiskey voice. And that comes from a lot of irritants, alcohol and tobacco primarily. You know, when you're sucking superheated gases into your throat and pouring alcohol into it, it does that kind of thing to you. Increased perspiration, and it smells bad too. You can one of the ways your body sloughs off alcohol when it metabolizes it is through perspiration, and you can smell it. If you're doing drugs with that, if you're eating pills and things like that, it will start smelling a little bit like you were pickled in a pill bottle, you know. And it's amazing how pervasive that smell is, especially for someone who's not around it all the time. You can walk into a room and smell where a drunk's been living, or you know, someone who's abusing alcohol and medication, because you'll smell it in the room. Fiery red palms, bright red palms. And they're known as liver palms because you're having difficulties with your liver, and it creates skin changes in the palms of your hands. Protruding abdomen, particularly an upper abdomen, caused by ascites, where fluid leaks back into the abdominal cavity and doesn't absorb fast enough. You get this with liver failure and pancreatitis primarily. And you probably shouldn't be paying attention to this unless you're doing something unethical, but pubic hair is thinned or lost. And that is something that occurs with drinking too, as well as shrunken testicles on men. We have testicular atrophy among guys who drink too much, and testicular atrophy among guys who smoke a lot of weed. So that kind of thing happens. Hemorrhoids, because of the difficulty we have sometimes going to the bathroom, and that becomes problematic over time. The alcoholic may be thin because even though alcohol has calories, they're empty calories, and they don't put a lot of weight on you. And alcohol is made from grain, but it has no real nutritional value, as we know already. Nutritional deficiencies among chronic drinkers are very common. It was one point in time, not too very awfully long ago, that doctors thought that cirrhosis of the liver was a function of malnutrition, that you didn't eat right, so that's what you got. It's not. It's the toxic effect of alcohol on the liver. But multiple bruises. When someone comes in, you don't want to be staring or doing, making them uncomfortable, but pay attention to the way they look. Are they clean? Or, are they well groomed? Or, are they wearing long sleeve shirts in hot weather, which might be to hide something that they don't want you to see on their arms? That kind of deal. But bruises, as we know already, heavy drinkers get hurt a lot. We bump and fall down and get beat up, and all kinds of things happen to us. And if we get bruised, those bruises stay on us for a long time. They don't heal as fast as they do with non-drinkers. Cuts, scrapes, bruises, we've generally carrying some around with us, and sometimes we don't even know where we got them. We've hit something, we bumped into something and it wasn't hard enough to hurt. It didn't cause us any pain. We didn't even pay any attention to it. But later on, we got a bruise the size, of a basketball on our leg or something like that. Swollen ankles because we retain water, and that's edema. The swelling around the ankles, which is a water retention issue, and we'll have ataxia, which is an unsteady walk with a broad gait, like we're walking on the deck of a rolling ship. And that's problematic for alcoholics. And we can see those things. They wear it on the outside. Alcohol butchers the body, by the way. It has a negative or deleterious impact on every major organ system we have got, from our hair to our skin, to everything is affected, deleteriously by alcohol. So there are visible signs and symptoms of chronic drinking that you can see, and we talked about that, with the little guy there. You have Murky's lines, or Traverse furrows, Bose lines that are in the fingernails. You can look at people's fingernails. You can look at their ears and see that there are symptomologies of heavy drinking there. There's also a flexion deformity that comes that you may find on some drinkers, called Dupuytren's contracture. John Elway's making a commercial about that now with his Denver Broncos. But let me go back here a minute and see if I can make this work. I don't know. Aha. I can't see. If you'll look right here, if I can get my fingers to go the right way, I'm doing things backward here, that is Dupuytren's contracture. I've got a touch of it. I can bring it to show and tell with you, right? And it looks like I got a little pinhole in my hand. But that's not what it is. Right here is a contracture of the ligaments in the hand, and they pull tight and made a dimple right there. When I'm not paying attention and relaxed, that finger will go in. Elway's got it bad, by the way. He's got, you can see the ligament standing up and pulling his finger down. Mine's not that tough. I got a little bit of it in the right hand too. You see the right over in here, but it's not much. It's not painful for me. I mean, it is for some people, but for me, it's not. I talked to a hand guy about fixing it, and he said, "Hey, I can do that, but it'll go back the way it was because you got Dupuytren's contracture, which is a flexion issue. And if I cut it and do surgery on it, it'll be a temporary fix, but it'll where's my hand? There it is. Pull back in again, when it's left to itself. And some people have noticed that, but a lot of people haven't, So again, it's if you're of Scotch-Irish descent and you, thanks Mom, and you drink a lot, thanks Mom's family and Dad's too, then you're subject to getting Dupuytren's contracture. Again, not painful, but aggravating. Gastrointestinal system, GI. It does a bunch of things to the GI. It interferes with normal digestion and metabolization, for one thing. Alcohol promotes the production of hydrochloric acid in the stomach. So it irritates the lining of the gut in general. People who are heavy drinkers tend to have more problems with acid reflux, GERD, gastroenter whatever it is. The stomach acid comes back up into the throat and irritates the esophagus. Alcohol also is a direct irritant on the esophagus, the tube that leads from the back of the throat down into the top of the stomach. There's at the top of the stomach, there's a little sphincter, a valve there that keeps the food that goes in from coming back out. And that valve gets irritated, doesn't work right. And next thing you know, you've got stomach acid up in your throat, things like that while you're sleeping. Alcohol interferes with peristalsis, the muscular contractions that moves your food away from, the processed food away towards elimination in the gut. And you have problems with that. A real danger with this, with alcohol and gastric erosion of the esophagus, is you get a condition called esophagitis, which is anytime you see an itis, it involves inflammation of tissue. And inflammation of tissue is almost always related to infection. So that's what you have. An inflamed and infected esophagus. And continued exposure to alcohol and to stomach acid causes erosion in the lining of the esophagus and the tissue of the esophagus. And this erosion is known as, oh my goodness, esophageal varices. I just lost a word there for a minute. Esophageal varices. And esophageal varices are dangerous. You've got a lot of blood up in this area. And you might find someone who is a chronic alcoholic who may be heaving because they're sick to their stomach, trying to throw up, all of that kind of stuff, or coughing, which is another way for this to happen. And they cause those varices in the throat to rupture. And when those varices rupture, blood pours out of you, and people will drown in their own blood or bleed out, because so anytime that's going on, it's kind of considered a life-threatening, it's a life-threatening situation. It's a serious medical problem that needs to be addressed right away. You also have ulcers in the stomach and irritations in the stomach, and that causes bleeding too. So people sometimes are throwing up because they're sick, because they've got hyperproduction of acid in their stomach, because the pyloric valve that dumps the contents of the stomach into the intestines is stuck, which happens with alcohol use. And you've got a toxin in your system that can't move on, can't be detoxified, and your body's only recourse is to bring it out, throw it up. and that can, be a problem, and you bring up blood, and it scares the hell out of people. So, and it should. Also, around that sphincter, up at the top part of the stomach, there's a bacterium that causes ulcers that lives up there around that upper sphincter, esophageal sphincter, and the bacterium's Heliobacter pylori, and people often get that, and it causes ulcers and gastric bleeding and that sort of thing. It's very uncommon. Uncomfortable is what I'm trying to say. It's also fairly common with GERD, with the gastroesophageal reflux that you could get. What else I want to say about this? So chronic irritation of the intestines, the gastrointestinal system, is a problem that is of long-standing nature with heavy drinkers, with people who are alcoholic, all the way from ulcerations of the throat to hemorrhoids on the other end, and everything in between is affected by drinking. If you smoke cigarettes, that compounds it. Both of these things taken together are heavy contributors to the development of cancers all up and down the GI tract. Pancreatitis. The pancreas is heavily involved in regulating things in your body and helping in the process of metabolization and of chemicals that we take in, and helping us to balance, for instance, sugar levels and things like that. In the pancreas, there are sites called isles of Langerhans, and the islets of Langerhans secrete insulin, and insulin's a hormone that processes sugar. If you have pancreatitis, you don't process sugar properly. And this is another reason that that diabetics should never, ever, 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 have I mentioned ever, drink. Because the pancreas will treat the alcohol like a sugar, and suddenly your sugar levels are way high because it's not breaking down the sugars the way it should be in the first place because you're diabetic, and now it's not breaking down the sugars properly because you're a diabetic and you're drinking, and problems occur up to and including diabetic comas and death. We already know also that diabetics don't heal properly. It's hard for a diabetic to heal, and that's what causes a lot of the amputations that they experience. That is terrifically compounded when you drink. Alcohol also causes acute pancreatitis. As an irritant, it causes problems for the pancreas. In both the pancreas and the liver, alcohol causes fat deposits to build up there, and the fat deposits build up in these ducts, and ducts carry bile, and the bile is used in breaking down food, detoxifying the blood, all kinds of good things. And if these things get plugged up, you get the fatty infiltrations become infections, and you get itises there, which is what a pancreatitis is, right? It is an inflamed pancreas, and it's generally inflamed because why? Right, because it's infected. If these ducts are blocked, then the bile backs up, and one of the theories to explain acute pancreatitis among drinkers is that the organ begins to digest itself. In any case, bile and digestive juices can't freely escape, but they do begin to weep out and back into the abdominal cavity, and that's what causes ascites. And ascites is that fluid buildup. And what happens with pancreatitis is we have, illness after illness that leads to a chronic situation, cumulative effects, if you will. Diabetes can result from this process, and if you have diabetes and you get this, you're really in a life-threatening situation. Pancreatic cancer is also more common with alcohol dependence than among those where there is no alcohol use disorder, and a lot of it is alcohol is carcinogenic. It causes cancer in a lot of places. Doesn't too much in the gallbladder. Gallbladder is one of the few things that you can say about the alcohol that it decreases the risk of developing gallstones and gallbladder disease. It helps to keep your gallbladder healthy. I don't think that's a good enough reason for being a chronic alcoholic, for drinking a fifth or two of whiskey every day while the rest of you is falling apart and saying, well, my gallbladder looks good, though. One of the organs that's immediately connected to alcohol as problematic, as being damaged, is the liver. And the liver creates the enzymes that the body uses to break down alcohol in the cytochrome P450, the metabolic system, right? And the first enzyme is ADH, and it begins to break down alcohol. But this liver and this metabolic system is also responsible for breaking down a whole bunch of other things, like food and things that we eat, the medications that we take. It manufactures components for blood cells. This is a very busy organ, both the liver and the pancreas. Lose either one of them, and you're pretty out of luck. They go, you go. I'm using my computer here, my laptop, in a very primitive way to record that, so I'm a little slow on the moving things here. Liver disease is one of the physical illnesses that's most closely associated with alcohol use. There are three common things that happen to the liver with someone who is abusing the liver with alcohol. And that's acute fatty liver or fatty infiltration, alcoholic hepatitis, and alcoholic cirrhosis. And I've always found it kind of weird to say that. I mean, I like this book. I like this writer and, the information that she shares. But you get rid of alcoholic, you get rid of most cirrhosis. That's a fact. By far, most cirrhotic livers are consequential to drinking alcohol. Now, there are people who get it from abusing other drugs. There are people who get cirrhosis of the liver from hepatitis C. There are people who get cirrhosis of the liver from some kind of exposure to environmental toxins. But by far, the majority of people who have cirrhosis of the liver have drunk themselves into cirrhosis of the liver. Acute fatty liver can develop in anyone who's been drinking heavily too. I mean, it's just taking in large amounts of alcohol interferes with the way the liver functions, and fats build up in the liver. And where you have fats building up, the liver doesn't work as well. It can't break down the fats as easily and move them out. And when fatty liver occurs, if you don't do something about it, it's likely to turn into alcoholic hepatitis, because after a while, the fats where the tissue where the fats are deposited begin to become infected and inflamed, and when you have an inflammation, that's what the itis is, right? So alcoholic hepatitis is inflammation of the liver, period. And there are all kinds of hepatitises that you can have that are associated, with environmental factors. Most of them are bacterial, not all. And you have hepatitis A, hepatitis B, non-A, non-B hepatitis, hepatitis C, hepatitis D, hepatitis E, non-specific hepatitis, and all of them are referring to infections, inflammations of the liver, and subsequent damage to liver cells. When you have a liver whose cells are dying, then you have cirrhosis. You have patches on the liver that are scarred. Cirrhosis is a Greek word. It just means scarring. And where the scar tissue is building up in the liver functioning is decreasing by that same amount. Your liver has to function to a certain level, and if it drops below that, unless something radical is done to change the situation, you will die. Your liver has to function to a certain level in order to sustain life, and if it's below that level, then there you have it. So the liver, oddly enough, doesn't regenerate the cirrhotic tissue. It doesn't turn it around. So this can become a real problem for people. And people who have hepatitis C through drug use, or people who have alcoholic hepatitis that turns into cirrhosis, then they're not very good candidates for a liver transplant. And, that's sad, but it's the way it is. Also, it's amazing if you ever get a chance to witness a liver transplant. It's absolutely amazing. You see the difference right away when they put that new liver in there and attach it. You can see the person getting well before your eyes while they're still on the operating table. Jaundice is a yellow cast, and that's where your skin and eyes are affected by the liver damage. It indicates that there is hepatitis in an individual when they're jaundiced. That's usually what the indication is. As I said before, you don't see the skin changes as much on darker skinned people. They're harder to observe, but you can see the changes in their eyes with a dark skinned person, or in the palms of their hands. You can see that there's some stuff going on there. In some patients, alcohol hepatitis is reversible. If you just stop drinking and eat well and take care of yourself, it may reverse. But then again, it may not. And if it goes on, then you're probably going to develop cirrhosis. And cirrhosis is deadly. If you don't stop drinking, if you don't find some way to arrest that, then the cirrhosis is going to worsen until it gets to a point where it can't sustain life anymore. Let me see what else I want to say about that. And talked about the ascites already. As a result, extracellular fluid in the tissues of the liver weeps directly into the abdominal cavity. This occurs with the pancreas as well. And normally this would be taken up by the lymphatic system, but with certain damages that you have to your body, you may produce more fluid than your body can reabsorb, in which case you have to do a shunt or find some way to drain this off. People who have ascites, their skin doesn't pop back the way it's supposed to. If you were to, give them a little poke, like the old Pillsbury Doughboy, when he giggles on that commercial, the skin doesn't pop back properly, and they slosh when they walk or move around. Like the guy with the goldfish there in his gut. Really nothing funny about it. I watched one of my best friends die with hepatitis C and liver damage, and they were pulling quarts of fluid out of him every day. And I couldn't imagine how he could produce that much fluid without drying up, without looking like a mummy. But he kept cranking it out. Anyway, so cirrhosis is a life-threatening illness. Gastrointestinal cancers, I've talked about that already, but let me reinforce that. Alcohol and tobacco use facilitate the development of cancers throughout the gastrointestinal system, and they include the pharynx, esophagus, stomach, colon, and liver. Wine is a lesser carcinogen than are the other fermented and distilled spirits. The hematological system is also affected by drinking. Blood is what we're talking about when we talk about the hematological system. And blood carries nutrients, it carries waste, it does all kinds of things. It takes hormones to the cells, it protects the body by carrying anti-infection agencies and white cells and all kinds of good stuff to the body. It patches holes in the body when it rushes platelets and clotting components to a rupture in the integrity of the skin or wherever, and help to plug it up. And alcohol interferes with certain elements in chemotaxis, which is white cell mobilization. It interferes in the process of red cell manufacturing. It does a bunch of things. And formed elements of the blood are profoundly affected by alcohol abuse. Red blood cells, and the most common problem involving the red blood cells is anemia. Anemia is a very generic term. It's like saying fever. You can, if you have a fever, it can be from all kinds of things. It may have been you were too long out in the sun. It could be that you have a cold. It could be that you have typhoid or rabies or, God knows what all. But fever just means that your temperature is higher than normal for you, right? So we have low-grade fevers and we have really high fevers, and we have fevers that can take us out. They're so serious. But anemia is that kind of word too. Anemia just means you have too few red blood cells. And if you have an insufficient number of red blood cells, then you're anemic. And there are all kinds of different anemias, and you have to figure out why a person's anemic. And people can be anemic in ways that defy diagnosis. You may have a bleed somewhere. You could have a tumor somewhere that's sucking a bunch of blood away from the rest of your body where it's needed. But anyway, you can lose red blood cells through bleeding. They can be lost through destruction, hemolysis, which is a normal thing that occurs in the body. We destroy red cells and rebuild them all the time. That's not a big deal. But red blood cells can't be manufactured if the bone marrow doesn't have the materials it takes to manufacture them. And that's what the marrow in the bone does, by the by, is that it manufactures red blood cells. So there are a number of conditions that can occur and a number of different types of anemias. Anemia from bleeding is called iron deficiency anemia. The iron in the red blood cells is lost. It's not available for normal recycling, and the body does recycle. So if you have too little iron to infuse the red cells with, then you have iron deficiency anemia. If you have sideroblastic anemia, then you have another anemia that's related to nutritional deficiencies, and this is too little of the B6 related cofactors. And you don't need to know all of this stuff for a test or anything, but this is just something that you in general knowledge of what anemias are about. There's megaloblastic anemia. Most of these are related to nutritional deficiencies. Too little folate or vitamin B12 will give you megaloblastic. You have some that are some anemias, or certain anemias, for instance, like sickle cell, that's genetically transferred, or spur cell anemia, which is genetically transferred as well. So alcohol interferes with the manufacture of red blood cells, and so you have anemia is common with heavy drinkers. White blood cells, before we get too far away from that, there's a condition known as porphyria that people used to get. It was pretty common back in the old days, and porphyria made you sensitive to light. So people who had this condition didn't go out during the daytime because they were hypersensitive to light. They stayed inside and generally only came out at night, or when they were really covered up during the day. And it caused anemia, which made them look pale. And the gums grew away from the teeth, and made their teeth look bigger. And this is an explanation, one of the explanations where the European vampire legends came from, and the people who were seen to be as vampires might have been suffering porphyria, particularly since they all had iron deficiency anemia and craved bloody meat. They liked their steaks and things raw. Kind of scary, huh? Anyway, alcohol also affects white blood cell manufactures and mobilization. T cells, T lymphocytes, are helper cells. These are the ones that HIV attack, by the way. The helper cells that go out and scout around looking for bad invaders so that they can come back and tell the cavalry, which are the cytotoxin white cells, to come out and kill this invader. The T cells are attacked instead by the invader, and the invader, in this case HIV, human immunovirus, attaches to the shell of the T cell and bores inside and uses its RNA and uses an enzyme named called transcriptase to superimpose its RNA on the T cell's DNA and transform it to where the T cell begins to reproduce HIV inside the cell until it compromises the cell dies, and all the HIV is re-released out into the body to go do its thing. White cells get drunk, and if you are pouring a bunch of alcohol in you, and some healthy T cells come by and say, "Come on, boys, let's go get it," they're like, "Later, man." Mañana, right? The white cells will also have a diminished ability to ingest bacteria. They don't function as well as they should function because of the alcohol use. Platelets is kind of like stop leak. If you've ever driven old hoopty cars like I used to all the time, you always want to carry a can of stop leak with you. And if your radiator overheats because you got a leak somewhere in it, you pour that stop leak in the radiator and reseal it. Put some water in there. And the stop leak goes to the hole, and the zinc begins to build up around where the leak is until it patches it. And then it stops the leak. And that's leak. And then that's kind of what platelets do. They're floating around in the blood, and if you spring a leak, they'll run to that leak and they'll start plugging it. May need a little help from us, like stitches or pressure on the wound or something like that. But eventually the bleeding stops, right? And that's how it's supposed to work anyway. if you're a drinker and you cut yourself, you're going to bleed a lot freer than someone who is a non-drinker who cuts themselves the same way. You're going to lose more blood than they have. Alcohol has a direct toxic effect on the bone marrow, which produces the red blood cells and also produces the platelet. And there are other clotting factors involved too, and the liver gets mixed up in this. So that the next thing you know, you've got a decrease in platelets, a decrease in red cells, a decrease in T cells, a decrease in white cells, and improper function of all of the above. So alcohol does a number on the hematological system. The immune system too. These are white cells and germs, or germs over there on the right. Alcoholics, people who have alcohol use disorders, people who drink heavily and may not be diagnosable, all have a tendency to catch things. They're not as healthy as people who do not imbibe alcohol in that manner. They are more prone to catch colds, COVID, any disease that rolls along, and that includes HIV and other sexually transmitted diseases. The body may be able to fight some of this stuff off if you're, if you're relatively healthy. Not so much if your immune system is compromised. HIV disease, by the way, is another illness that you should never drink with. You should not drink if you have this illness because it hastens the onset of AIDS. In other words, it makes the illness worse. It exacerbates the problems that you have. If you have diabetes, you shouldn't drink. It exacerbates the problems. If you have epilepsy, you probably drank yourself into that, but it exacerbates the problem. So anything that it makes worse, you should avoid. Alcohol is also a risk in sexually transmitted diseases because why? You know why, don't you? Sure you do. It's because you make crummy choices when you're drinking, It's like you wake up in the morning and you're the cheerleader and you look around and the first question you have is, you guys all on the same team? You make bad decisions. If you make bad decisions and get sick, you can also make bad decisions and make other people sick too. So coupled with your tendency to get sick, your inability to get well, and your poor choice making, you can be a thoroughly dangerous individual running around intoxicated. All right, wait a minute. It's not supposed to work like that. Let me see if it does this. Okay, there's the immune system. Ah, come on. Heart is what I'm trying to get to, and I'm thoroughly screwing it up here. The cardiovascular system is affected by alcohol, and there's a specific form of heart muscle disease known as alcoholic cardiomyopathy, alcoholic heart muscle disease. It only happens in like 2% of the people who with alcohol dependence, and that's 2% of 10%. So it's a really low number of people who drink. But there's another 80% that have a similar type of disease, that similar type of abnormalities, but they're not as serious as cardiomyopathy, alcoholic cardiomyopathy, which kills people. It's a pretty bad illness when you have it. You die of low output heart failure. Your heart just doesn't work well enough to sustain life anymore. Other types of alcoholic heart diseases, alcoholic beriberi, which is high output congestive heart failure. And it seems to be associated with the deficiency of thiamine. Alcohol kicks the hell out of the nutrients that you take in, and how your body utilizes those nutrients. So a lot of the illnesses that we see, both with the heart, with the blood, and also with the brain, are related to nutritional deficiencies as well. Hell, the skeletal system, the skin, come to think of it, there's a whole bunch of things that are all related to... I just got a thing that asked me, was I ignoring Stacey Abrams? That was that ding that was on my computer. Took me a minute. I'm slow on the uptake today to compute who Stacey Abrams was. I know now, but for a minute. There are tachycardias and fibrillations and arrhythmias that are all associated with alcohol use, and these are heartbeat issues and palpitations of the heart. Let me do this for just a minute and say your heart doesn't look like that. It looks more like that. And it's a muscle, it's a pump, that's what it is. And it does this, right? And it sucks blood in, out, in, out, in, out. And that's what it does. That's that boop, 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 boop that you hear. If you're drinking alcohol, it may palpitate. And the rhythm may go boom, 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 boom. You get the drift. It's not doing the boom, 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 boom rhythm that it's supposed to be doing. You can have arrhythmias, you can have palpitations or spasms, if you will. This happens a lot with cocaine use. When you fall into atrial fibrillation, for instance, your heart is boom, 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 like it's supposed to, and you do a whole bunch of cocaine, and now all of a sudden your heart's doing this. And so it's not taking blood in right, and it's not putting it out right, and you're having a fibrillation issue that we commonly refer to as a heart attack. And it will kill you. And if someone's sitting around with a defibrillator paddle or two, they can pop the heart with that, and it will shock it. And it will stop it from beating for just a second, and then it will pick back up again. But it's not the fault of the heart muscle that you're having this fibrillation. The fault is because you have a drug that's affecting your brain that's causing sending the signals that causes the fibrillation. And that drug's still there. The electric paddle didn't shock the drug out of your system. So your heart goes back into fibrillation, and they shock it again. And, that may work. And then after they've shocked it 3 or 4 times, they usually stop, because shocking the heart muscle multiple times is going to wreck the heart. And they're not able to keep you alive if, they're not able to achieve a heartbeat within a few shocking moments, if you will. So the heart is affected sometimes by the drugs that we take, by the alcohol and cocaine and things like that. Some of these effects are short-term. Some of these effects are more acute. We can address chronic situations with, chest compressions or something like that. But we can't acute situations. But we can address the chronic circumstances where you have long-term heart damage from alcohol use. An interesting thing, and this was something I got from my late friend Kay, is that, well, alcohol. That she used to tell me that there are studies done that indicate that alcohol consumption actually is good for the heart. And if you drink like 4 ounces of wine every day, it promotes heart health. Your heart's healthier if you do that. You don't have as much hypertension and stuff. And I countered that with Kay. It's not just alcohol, it's wine that they're talking about, and not just any old wine, it's red wine. And it's not the alcohol that helps, it's the grapes. If you eat the grapes, you will have the same beneficial effect on the heart. It's not the wine, it's the grapes. To which she replied, smart ass. Because she didn't want to hear that. But with her 4 ounces of wine she was drinking, there is a definite link between heavy drinking and hypertension. If you have high blood pressure, if you're hypertensive, you shouldn't drink. It's right up there with epilepsy and diabetes and other things that you shouldn't drink with. Hypertension's another one. It makes the matter worse. Genitourinary tract. The more you drink, the more you pee. How about that? There's antidiuretic hormone, ADH, that's produced by the hypothalamic pituitary region of the brain. And this antidiuretic hormone is dumped into the blood, and it runs around, and it signals the kidneys don't release urine. It kind of seems like it's working kind of bass-backwards if you think about it, but that's how it works. And ADH causes water to be reabsorbed to maintain a fluid balance. And the kidneys, if they're constantly letting water out, then you get dehydrated, right? If you are drinking alcohol, if you're drinking beer, you're taking in a lot of fluid. And you got a whole bunch of other stuff in that beer besides that 5% or so alcohol that you're getting, right? And so all of that other fluid, that might make you want to, increase your fluid intake. If you drink more water, you drink more coffee, you drink more tea, you drink more soda, you drink more juice, whatever you're drinking more of liquid, you're probably going to have to pee more. But it's not just about fluid volumes. Alcohol interferes with the production and action of the ADH, so that your kidneys don't get the message saying don't go. So they're busy releasing fluid and not absorbing fluid, which is also another big part of what they're supposed to be doing. So you have to go to the bathroom more. And it doesn't matter if you're drinking 12 ounces of beer, 4 ounces of wine, or 1 ounce of whiskey. It's the alcohol that's causing you to go and do these things. Your body to do this thing sends you to the bathroom more. And as you go to the bathroom more over the course of the evening, then go home and go to bed. Tomorrow when you wake up, you're parched, your throat's dry, you have a headache, you got a belly burn. This is because you're dehydrated. You've eliminated too much fluid during the night, and you're thirsty to beat hell. So wanting to drink a lot of water or whatever else is available. So that goes on. Alcohol doesn't have a real necessary deleterious effect on the kidneys directly, but the kidneys can be affected by the alcohol's effect on the liver. And the alcoholic's effect on the liver creates toxins that are in the bloodstream, and they affect a lot of different organ systems, and the kidneys being one of them. So that happens. A nearly always fatal but very uncommon consequence of chronic heavy alcohol use is hepatorenal syndrome. And this is where the liver is shutting down and it's pumping toxins out. It's not purifying the blood like it's supposed to. And there are factors that cause shifts in the kidneys' blood flow and causes the kidneys to shut down. And then, unless you've got a transplant waiting in the wings, you're probably going to die from it. Reproductive system and pregnancy. Well, alcohol affects the reproductive system. It affects the reproductive system in men. It affects the reproductive system in women. We don't know how clearly that works for women. Frankly, women have not been studied to the extent that men have been studied, particularly in the area of alcohol's reproductive effects. What happens if the father is drunk at the time of conception, and when he passes his sperm along to fertilize the egg, along with all of the genetic data that that sperm cell carries? It also carries bound alcohol or other drugs in that what does that do to the embryo? What are the implications for the developing child that may be in the future, or the delivered child in the future? We're not real sure. Scientists are not absolutely sure what happens. Probably something, and that may have something to do with that whole genetic probabilities with developing alcohol use. But we do know that drinking on the part of the mother is a very, very bad idea. After she's impregnated, because fetal alcohol syndrome is the most preventable form of mental retardation in the United States, and probably in the world for that matter. Anyway, so what else I want to say about that? Oh yeah, performance. Excuse me, I got distracted by the incoming message and lost my train of thought. Let me go back. The fetal alcohol syndrome is the #1 preventable form of mental retardation in the United States and probably in the world, and it is directly caused by the mother drinking while she's pregnant. There is no other cause. Dad has nothing to do with it. Nothing else has anything to do with it. It is purely the mom is drinking while she's pregnant, and that leads to developmental defects and that sort of thing. Drinking and the ability to perform sexually is different for men and women. A woman, if she's not aroused, if her head's not into it, if she's disinterested, whatever, she can still perform because of her role in, coitus, heterosexual coitus. Guys, on the other hand, if they're expecting to perform, guys can assume various roles in coitus too, right? But if they're going to be the pitcher in this game, then they have to have an erection. And sometimes they don't. It's called brewer's droop. Guys who drink a lot often have difficulty achieving and sustaining an erection long enough to complete coitus. They also they're also desensitized, so they may be able to. I don't know if be enable's the right word. They may be in a position or condition where they go for a long time, but they can't have an orgasm, and it can be very frustrating to the man and the woman too. And this may also occur with the condition that's known as priapism, which is where you get an erection that you can't get rid of. And this, from what I understand, it's not nearly as much fun as it sounds like. So that, even though they're able to achieve an erection and use it, they are frustrated because they can't ejaculate. They can't have an orgasm, is a better way to put that. Male and female hormones are involved in these types of responses. Women, even though they are able to, to complete a sex act this way, and whether they're into it or not, often report getting no pleasure from it. And there are also people, and you'll see them, they'll be in your office someday, who might make what for them is a shameful disclosure that I can't do it unless I have something to drink, unless I smoke a joint or something. It's no fun. I'm not interested. So sexuality is tied up all into alcohol and other drug use, at least for the people who have these types of disorders. A direct effect that alcohol has on male hormones is to lower testosterone levels, and that has something to do with both sexual performance, erectile dysfunction, that kind of thing, and interest in sexuality. Increased levels of female hormones in alcohol-dependent men is caused by decreased liver metabolism. Both men and women have both estrogen and testosterone, and our bodies, metabolize it at different rates, etc. The liver's ability to metabolize testosterone in the male body, as well as some other female hormones, lead to guys who have atrophied testicles. There's been a loss of testicular mass, atrophy. We may develop breasts. We have, loss of body hair, all kinds of things that occurs. So that can be kind of risky too, especially if you start using when you're really young. What else do I want to say? Sex hormone alterations in women are not as clearly understood. They need to be researched further. Maybe some of you guys will be doing that. I don't know. And a problem with, I don't know if it's in here anymore. There was one, there it is, from Macbeth. Macduff asks the porter, "What three things does drink especially provoke?" And Porter responds, "Marry, sir, nose painting, sleep, and urine. Lechery, sir, it provokes and unprovokes. It provokes the desire, but it takes away the performance." And that's true. A lot of the sexual dysfunction that goes on with men and women is psychological, by the way. And guys who have been using alcohol or other drugs, for long periods of time, may not have had a lot of sexual encounters when they weren't under the influence. And we can get it into our heads that we can't do what there's no physical reason that we can't do, and then we're not able to perform at that point too. The minute you think, "I hope I don't," you do. So it's that's an issue. But so if you're working with couples, if you're working with recovering couples at some point, you may find that there's a lot of sexual dissatisfaction there. And we're not sex therapists, but that may be something that we have to allow people to discuss. Fetal alcohol syndrome. If you look over here, small head circumference, and the head's not as big, low nasal bridge, epicanthic folds are narrow, look kind of Asiatic. In fact, people with this disorder, with this condition is probably a better way of putting it, tend to have an Asiatic look about them, and that's how we got the expression mongoloid when talking about Down syndrome children. They look like they were of the old mongoloid racial types when we use that division. So there's short eyelid tissues, narrow epicanthic folds, short nose, small mid-face, the indistinct infranal depression. That's that little dimple between your nose and the top and your top lip, and a thin upper lip. Now, there are a lot of these folks who have fetal alcohol syndrome or fetal alcohol effect are developmentally impaired, but they're not really at the level of intellectual function where you could call them mentally retarded, but they're very slow and they function, but not particularly well sometimes. And this is due to long-term exposure to alcohol while in the womb. And let me assure you guys right now that today, somewhere in Harris County, a baby's being born, and you can slap him on the ass, and when he cries, you can smell alcohol on his breath, because it's happened that recently. Anyway, and they're born addicted to other drugs too. It's a problem that we have in our world. The adverse effects, there's no real safe level of alcohol to consume. The less you drink, the less likely you are to have damage, but that doesn't mean that you're guaranteed that there's no damage. So the best thing that you can do if you're pregnant or think you're pregnant is don't drink, don't use drugs, and that includes cigarettes, by the way. And here's talking about the IQ levels and stuff. You can read that on your own. We also see things, and I may try to do if not this semester, then next semester, to have a lady present about who works with the Lakota people up on Pine Ridge in South Dakota, and they have a problem with alcohol on that reservation. Most native reservations, alcohol is a problem for a number of reasons. But one of the things that we see at Pine Ridge is, people don't live as long on the reservation as they do off the reservation. Their lifespan is significantly less than the national average. And one of the things that we see on the reservations that is different than the national average is second, third, fourth, fifth generation fetal alcohol syndrome, fetal alcohol effect. That means that this child who has fetal alcohol syndrome is the child of an adult who has fetal alcohol system, who is the child of an adult who has fetal alcohol system, who is the child of an adult who has fetal alcohol syndrome. You get my drift? And so that these people who have FAS, FAE are having children who are also FAS, FAE, and it becomes a real problem where poverty and poor health care and poor diet and all of this good stuff is going on. Alcohol affects normal breathing, the respiratory system. People who drink a lot tend to have poor pulmonary functioning. They don't breathe well. and they are prone, especially if they combine it with smoking, which a lot of drinkers do. A lot of smokers drink, a lot of drinkers smoke. And they affect the lungs in a number of ways. One is by the cilia. You see this little cartoon over here of normal cilia. And cilia, to me, looks like seagrass. I like diving. And if you're underwater sometimes, you can see the currents affecting the seagrass. It's really beautiful. But how it waves back and forth under the water with currents that, I can barely feel, but they're there. And it's causing the seagrass to move. It's pretty. And that's the way cilia look. They move back and forth, and they're picking up. When we're breathing, we got this great nose hair that filters some things out to keep the big particulates out. And we have all these kind of filters that are there to help us keep stuff out, but stuff still gets in. And after a while, the cilia pushes it up, and we go, and it's gone, right? So you have that function going on, except when you're drinking. And then the cilia just lay there, and they don't move stuff out the way they're supposed to. Anyway, chronic alcohol use is a clear risk for the development of acute lung injury and respiratory distress through the use of alcohol. In fact, if we die from alcohol overdose, which is really an effect on the brain, there's two ways that we're probably going to die. If it's a direct from alcohol overdose, one is that we're going to pass out and throw up and inhale the vomit. And basically we're going to drown because we put vomit in our lungs instead of air. Or the other way is that we ingest enough alcohol that we put to sleep the part of the brain that controls breathing, and then we suffocate. It's not a direct effect on the lung, but it is a way to die. And so respiratory arrest is a way to pass. If you have a compromised immune system, you're more likely to catch viral pneumonias that are floating around. You're more likely to get, if you survive that drowning event where you inhale vomitum, then chances are pretty good you're going to get a lung infection out of that. It may be pneumonia. And if you're smoking and stuff, the possibilities of lung problems with people who drink and smoke are just endless, including things like tuberculosis, chronic obstructive pulmonary disease, lung cancer, and those kind of things. And what else have I got here for you? I didn't think about that coming to my office here, but I keep getting my little message things are popping up on my other computer screen, and they're more distracting than I gave them credit for being. Endocrine system. This is hormones. Hormones are signaling chemicals that are produced by particular targets, by particular groups of cells, and we call these groups of cells glands. And glands produce the hormones, which are the signaling chemicals that they dump into the blood, and the hormones float around to the blood till they find some target cells to interact with, and then they give their message to the target cells, and what happens, what's supposed to happen. Alcohol can affect the endocrine system in three major ways. The first is it can alter the function of the pituitary gland, where you have a greater or lower pituitary output. And if it changes the pituitary output, which is the master gland, the control gland, then the other glands don't get the instructions or the proper instructions about how to function, and they're either overproducing or underproducing. An example here is it's believed that chronic heavy alcohol use may lead to premature aging through alcohol's chronic activation of the HPA axis. And that may be true. Drinkers age faster than non-drinkers. Again, you wear your alcohol use on the outside. People can see it. Alcohol can also affect other glands directly. They get the correct instructions from the pituitary, but alcohol interferes with their ability to do their job, to do what they're supposed to do. It either blocks or the process and production or release of the chemicals, or whatever. It does a number of things, so that you have a lowered output, or it will promote an increased output. In either way, even though the glands received correct instructions, their output is altered. And third, interference with normal endocrine function can result from alcohol-induced liver damage. It's not the alcohol directly doing anything to the endocrine system. It's alcohol doing things to the liver, which in turn is doing things to the endocrine system. So it's there's complex relationships on here, I'm not going to go into each of these in particular today, but you can read these for yourself anyway. Changes in LDH and HDL and cortisol and all of this good stuff produces changes in the body that are hormonally related, and this includes skin changes, sex drive changes, growth changes. It's pretty rife with changes. You can also get hyperglycemia or hypoglycemia, which has to do with your sugar levels. Cancer. Again, heavy drinkers are known to have a higher incidence of skin, thyroid, laryngeal, oral, head and neck, esophageal, stomach, liver, lung, colon, prostate, and breast cancers. And if you're not worried about any of those, here's to you, drink up. This, by the way, isn't hypothetical, guys. This is for a fact. This is empirical. This beverage does this stuff to you. Cancer is abnormal cell growth. That's what tumors are about. And there are a bunch of alcohol and a bunch of its metabolic byproducts that are formed, like acetaldehyde, is both carcinogenic, causes cancer, and it's mutagenic. It causes changes in the tissue and the organism in which is exposed to it. So the cell's protection is compromised. The integrity of the cell's protection is compromised when you expose these cells to alcohol or alcohol metabolites, and this can lead to cancerous conditions. Chronic alcohol use affects the skin too, and skin changes may reflect, dietary issues, may reflect endocrine issues, may reflect a bunch of things. May reflect damage done through exposure. People who get drunk and do things like I did one time, fall asleep on a diving board at a swimming pool, and wake up so burnt that I couldn't move for the better part of a week. I may still have a little skin cancer to pay for that episode sometime in the future. I don't know. Are people who go out and expose themselves to dreadfully low temperatures because they're intoxicated. A problem on the Navajo reservation just outside of Page, Arizona, for a long while, really, was that some of the indigenous people in the wintertime would get drunk and not make it home and fall asleep out in the snow and be found dead later. Heavy and chronic alcohol use causes skin conditions. It causes you to flush. It causes rosacea, which is a skin condition, and predisposed people where you have a red rash that develops usually under the eyes and on the cheeks primarily. And lots of inflammation there. Build up of cartilaginous tissue, which is the rhinophyma, the rum nose. Porphyria cutánea tarda, and this is the condition I was talking about earlier, the vampire condition that leaves you, sensitive to the sun, and others. The spider angiomas, the liver palms, all of that good stuff. Skeletal system is affected too, and this has to do with increased levels of organic acids that fluctuate with heavy drinkers. As we get older, we lose bone density anyway, bone strength, and so old people particularly tend to have skeletal issues, have bone issues. Aunt Agnes, we'll say, how are you doing on Facebook? Well, I'm doing fine, but I had to go see Aunt Agnes. She fell and broke her hip the other day at the nursing facility. Oh, well, that's terrible. And I haven't gone to the nursing facility to find out, but there's a pretty damn good possibility that Aunt Agnes was just standing there or going on about her business, and her hip broke, and then she fell. She didn't fall and break her hip. Her hip broke, and then she fell. Degenerative arthritis. There's a number of arthritises that are associated with alcohol use. There are a number of gouts that are associated with alcohol use. And then there's the degeneration of bones that just happens over time. Degenerative arthritis is the old age arthritis. Septic arthritis is an acute infection in a joint space. Arthritis, by the way, there's that itis again. So inflammation of the joints is arthritis. Osteoarthritis has to do with roughened joint surfaces, but it too is that inflammation of the joints. And you see that all over the skeletal system. Osteoporosis is a generalized thinning or demineralization of the bones. The bones get weaker. Osteoporosis is a real problem, particularly for women, but you see it with men too. People who otherwise went through most of their life ramrod straight and with good posture, now their shoulders are stooping forward and more forward and more forward and more forward until they're really bowed over. Aseptic necrosis is a form of bone death. Well, that's what it means, is bone death, especially at the head of the femur. And that's what usually breaks when someone has a broken hip and falls down. Individuals who have regularly used large quantities of alcohol are more likely to have these skeletal conditions than people who have not So it's just another thing to look forward to if you get to be an old drinker. What did I do? I jumped right over here to something else, didn't I? Yeah, there it is, aseptic necrosis. The nervous system is perhaps the most profoundly affected of all the major organ system by the effects of acute and chronic alcohol use. The more you use it over time, the more it changes how your nervous system functions. And that's where you get dependence and tolerance and craving and withdrawal from. And if you have predisposing conditions like a history of a positive history of alcoholism in first-degree blood relatives and things like that, then chances are pretty good that you'll develop it too, and you'll have a predisposition towards dependence, tolerance, craving, and withdrawal, all of which are functions of the CNS. A friend of mine, who was an old mentor of mine, said that the best way to tell if someone has a chemical dependency or has a problem with chemical dependency, alcohol, other drugs, is to take his dope away from him and see what happens. It won't be long till you'll start seeing some effects that tell you this guy's got it going on. And it's going on because he starts having withdrawal syndrome. There's an abstinence syndrome that's associated with physical addiction. And if you take a person's drug away and they start having symptomologies consistent with an expected withdrawal syndrome, then you have someone who is physically dependent. That is the key indicant that there's a physical dependency there. But you can medicate that. If it's just about getting people over physical dependency, we'd have a real good record with treatment. We'd put them in a hospital, put them under the care of a physician. We'd give them medications to help facilitate the withdrawal, bring them down safely, and then we'd let them out and say, "There you go. Good job. Don't do it again. Don't want to see you anymore." Except it doesn't work that way. And if you just get people over the acute withdrawal syndrome, there's still some issues that you might need to consider, and that they might need to consider too. One is tolerance. If you've been drinking a lot over time, then you tend to develop a tolerance, and the tolerance is such that it takes you more alcohol to get where you want to go now than it used to when you started. It takes you more cocaine. It takes you more heroin. It takes you more fill in the blank to get where you want to go now than it did when you started. And that has to do with changes to the CNS. And if you remember, if you start partying, when you start partying and you're around with your buddies and stuff, and they're all passed out and walking into walls and falling down and going to sleep, and you're going, "Damn, what's wrong with those people? They can't hold their liquor." They're not the one behaving abnormally. You are, and they're doing what you should be doing if you had a normal metabolism, but you have an abnormal tolerance, and that's not good news. So tolerance can trick us in recovery. People think because they've been sober a long time that they're going to be able to drink again or use again or whatever, and I can go back to where I was when I started, and this time I can control it better. That's an unrealistic expectation. If you're physiologically addicted to the drug and you've had these types of changes happen in the central nervous system, it's not going to be that way for you. Craving is also associated with changes in the CNS. Not only does it take you more to get where you want to go, but when you're not using it, you find yourself really, have I mentioned really, wanting to use, needing to use. And these cravings that chemically dependent individuals get, that people who are addicted to the drug get, are unbelievably strong. They're terribly strong. A movie that I like, and I don't recommend it for everyone, but if you were to want to check it out, you could probably get it on, Showtime. I mean, on Amazon or Netflix or something like that. But it was done. It's an older movie. It was done back in the 90s. It's called Train Spotting, and it was filmed in England and Scotland, and it's about a group of English heroin addicts over there. And one of them, the character Renton, has decided that he's going to sober up, and he's talking about the things that he needs before he quits heroin for good and all, right? And so he goes into the room. He's got a portable TV set, a black and white TV set, to watch TV with. He's got pornography, for whatever he wants pornography for. He's got 2 buckets, one to throw up in and one to defecate in, because he's going to be doing both, and he knows it. He's got some soup and a hot plate for, all of that. Then he closes the door and nails boards up over it. Like that would keep him in, right? And he's narrating all of this as he's doing it. And then he said, but then there's one more thing that everyone has to do before they sober up. Do you know what that is? Yeah, I heard you. Yeah, get high again. So the next scene is with the boards torn off of the door, and Renton's out looking for dope. Craving is strong. Craving, and they talk about the hijacked brain, and that's real. Physiological changes take place, and this craving takes place in areas of the brain where you usually associate survival instincts. It feels like you're going to die if you don't get something. It's like life-threatening. It's a very, very strong thing to do. And we've got medications now that are pretty effective at reducing craving, but they're pretty expensive too. And also we have a prejudice against using them in treatment. A lot of treatment programs still have the idea that you don't really need that. All you need, if you really want to get sober, you're going to get sober. And that may be true, but if we can alleviate the risk, if we can reduce the risk, and if we can alleviate the suffering of someone who's going through this, then maybe we should. I'm a believer in medical assisted treatment, but that's me. Some people aren't. Alcohol idiosyncratic intoxication. Idiosyncratic intoxication is also referred to as pathological intoxication, but when something's idiosyncratic, is specific to that thing, and so if I have an idiosyncratic response to cocaine, I might do a line and fall asleep. If I have an idiosyncratic response to speed, I may do some of it and go eat a hamburger. So something is occurring, probably more to do with my individual makeup than with the drug, but these two things come together in such a way that I respond to the drug in a way you wouldn't expect me to, basically, or a little bit of the drug. This is also reflected in a peculiarity with tolerance. Another old movie was called Blind Date. had Kim Basinger and Bruce Willis in it. And Bruce Willis was the guy who had the blind date with Kim Basinger, and his buddy who set him up with her said, "Man, she's a wonderful girl. She's smart as anything. She's beautiful. She's got a great sense of humor. You'll love her. Just don't let her drink." And it's the "don't let her drink" that was the ominous foreshadowing. He does let her drink, and with very small amounts of alcohol, she goes clinically batshit crazy. Starts fights, creates scenes, makes a spectacle of herself, steals his car, wrecks his car, does all this kind of stuff, and then doesn't remember it. That is played for laughs, and it's very and is very exaggerated in terms of that, but that's idiosyncratic intoxication. Now, I have had an aunt, she's passed on now, rest her soul, who would be very, very, very insulted were she to hear me talk about her having alcohol idiosyncratic intoxication, but she did, and with just very, very little amounts of alcohol, she got mean as a sore-toothed snake, and she was loud-mouthed, mean, insulting. I've had to drag her away from a fight or two, and then she wanted to fight with me, kind of thing. This has happened a handful of times, in all the years that I knew her, because she didn't drink. And she would say today, she said, "Well, I couldn't be an alcoholic. I don't drink enough to be an alcoholic, I would avoid that label, alcoholic. I don't think it's an important label. That's just me. Does that make sense? I don't think it's an important label. What I do think is important at this stage of the game with someone like that is that you may not be an alcoholic, but you do have an alcohol problem. If this happens to you, then you have an alcohol problem. If you have low-dose intoxication events that include hallucinations, violent outbursts, inability to control yourself, sexual adventuresomeness, all of that good stuff, and then you can't recall later what went on, that's not a normal response to the drug. And what that is alcoholic idiosyncratic intoxication. You will see it, probably, more likely than not. Also associated with all of that stuff is organic brain disease. And organic brain diseases are things that happen physically to the brain due to the insults that we visit upon it with various drugs of abuse. I had it explained to me one time a long time ago that every time you get drunk, it's like you've had a closed head injury. Chronic traumatic cerebroencephalopathy, or CTE, that football players get from getting smacked in the head too many times. We used to say it with prize fighters. We said they were punch drunk or punchy because they've been hit in the head too many times, and now they're slow on the uptake, or emotionally labile, not laughing and 1 minute crying the next, that kind of thing. Happy 1 second, angry the next. This is due to traumatic brain injury, and you get traumatic brain injury by drinking alcohol. And when you drink alcohol, it has a damaging effect on brain cells, on brain tissue. And a lot of, we have a condition that's associated with heavy alcoholic use called cerebral atrophy. And cerebral atrophy is where the brain actually loses mass. It shrinks because it's been exposed to alcohol. You can get alcoholic dementia, which is Alzheimer's-like conditions that you just basically drink yourself into. And there are a couple of brain diseases that sometimes you see them linked together as Wernicke's-Korsakoff's. But Wernicke syndrome and Korsakoff psychosis are actually two different syndromes, even though they're closely linked to one another. And both of them are tied to alcohol use, and both of them are consequential to vitamin deficiencies because, again, if you're a heavy drinker, your body doesn't utilize vitamins correctly. That makes sense. So, anyway, both are caused by nutritional deficiencies, and especially thiamine, which is vitamin B1, and in combination with whatever toxic effects alcohol has on nerve cells in the brain. Both of them are involved memory and ability to recall things, and the difference between the two syndromes in terms of pathology is that Wernicke's syndrome is treatable, and it involves injury to the midbrain, to the cerebellum, and areas near the third and fourth ventricles structurally in the brain. Korsakoff's psychosis results from damages to areas of the brain that are important to memory and executive functions, and with the more sophisticated areas of the brain, also with peripheral nerve tissue. Wernicke's syndrome, you'll have inability to recall things. You'll have difficulty focusing your eyes, slow eye movement, that kind of thing. But if you arrest the drinking, get the person into treatment, stop the drinking, improve their physical condition, and particularly improve their diet, start giving them supplemental vitamins and things like that, B1, thiamine, then they tend to improve, sometimes quite significantly. But if you have Korsakoff's, no such luck. And people who have Korsakoff's have not just a memory problem, but they have a psychosis associated with it. There's a dementia-like psychosis, and eventually will probably require nursing home or custodial care because you've drunk yourself into that condition. A person with Wernicke's is confused, delirious, apprehensive, has the nystagmus, the abnormal eye movements, as well as the possibility of paralysis of eye muscles. And these eye abnormalities are the first things to appear with people who get this condition. They have difficulty walking, they stagger, ataxia, remember, broad-based gaze. It has to do with alcohol's effect on parts of the brain that control balance. And both are caused by peripheral nerve disturbances and all of that. A person with Wernicke's may be confused and have difficulty remembering and have difficulty following in a conversation and stuff like that, but distance from alcohol, distance from the last drinking episode, a regimen of exercise and diet and rest to improve their overall physical health and to improve, to make sure that they're getting proper nutrition, getting their nutritional needs met properly. I'll get it out here in a minute. Then you have a pretty good outlook with them. Korsakoff's psychosis is somewhat different. There's severe memory loss, but the thing that probably defines Korsakoff psychosis more than anything else is a condition called confabulation. And that's making up things and talking fluently without any regards to facts. It's either Korsakoff psychosis or you're a politician. I don't know which. But the confabulation is the hallmark. So I come in to see a client this morning, and I say, "Hi, I'm Howard. I'm very glad to meet you." And he said, "Hi, Howard. I'm glad to meet you too." and I tell him I'm going to be your counselor, and I just wanted to stop in and introduce myself, and I'll be back to see you, later this afternoon to see how you're doing. Okay? Okay, good. And we're agreed on that. And away I go, and I do my business. And 2 o'clock in the afternoon, I come back, and I say to my client again, "Hi, I'm Howard. Remember me?" And he said, "Oh, hell yeah. You're Ricky's older brother. Man, I remember you. You used to let us use your car and shit. And I remember that time me and Ricky went da-da-da-da-da-da-da." And I've never laid eyes on this guy before. He's remembering something that didn't happen. Is he psychotic? Is he making things up? Is he telling me a lie? And the answer to that is no, for the most part. He is psychotic because he's dealing with a different kind of reality. He appears alert and responsive. He's talkative. He can remember, what happened years ago in some instances, but he can't remember what happened this morning. He can't remember what he had for breakfast. He can't remember meeting me. So he puts me in a scenario, in a story of things that he can remember. It's not a lie. It's not trying to mislead me. It's not trying to do any of that. It's a broken brain trying to make sense out of the environment and the history that it's experienced. So he's pulling a snatch of this and a snatch of this and stitching it together and seeing if it will work. And he's going to get worse. And I can give him all the vitamins in the world, and it's not going to help. He's not going to be a successful candidate in treatment. He will probably need, assisted living from pretty much that point on. The memory impairment is the key issue with that. So they don't have enough memory to be tricky. Cerebral atrophy is generalized loss of brain tissue, and we talked about that, brain shrinkage. Brain shrinkage occurs anyway, naturally, but it just occurs faster if you pour a bunch of alcohol on your brain. Our brains mature, hit their top capacity when we're in our mid-20s. And you don't have to wait till you're old to decline. If you're in your 20s, you're doing it now. If you're 25 or beyond. And if you continue to drink, when you accelerate this process, you can drink yourself into alcoholic dementia and alcohol-induced persisting dementia. And there are a lot of factors that are involved in that, but the key one is long-term exposure to alcohol, pickle in your brain, basically. Treatment of any of these conditions generally are going to require some kind of medication, and they're going to require a change in diet. But the key thing they're going to require is a cessation of drinking, because if you drink, it's going to get worse, and that's the basic bottom line of that. So it takes a long time for a person with Korsakoff's to get better, and only about 1 in 5 do. Is not as gloomy as I first painted it. If you can get 20% of the people well, but the recovery process is slow. It takes a long time, and the mortality rate is around 15%. The dementia associated with cerebral atrophy is irreversible. But if you arrest it and provide proper nutrition and therapy and stuff, it may not get worse. You can keep it from advancing. Alcoholic cerebral degeneration is a late complication, more likely to occur in men, typically after 10 or 20 years of heavy drinking. and that's the slow, broad-based, lurching gait as if they're about to fall over. True confession time for Howard. I'm sitting here in my office. No one's around. I'm talking to a computer screen. The only thing like a person that I see and here's a reflection of myself in my window, and so I'm kind of distanced from you guys, and I don't get to see your reactions and responses to the things I'm talking about, and I don't get to hear if you have a question. But you know what I think, and I believe this. I think some of you are in recovery. I'm pretty sure from having talked to a few of you that I've got people in recovery. And if you're in recovery and you go to meetings, I'm telling the truth. You can go to an AA club or an NA club anywhere in our area, anywhere in our area, and you'll run into people at that club. And when you talk to them, you find out they've got 5, 10, 15, 20 years sober or more. Nice people. But they look like they just rolled off a bar stool. They've got all of that physical damage that I talked about before. The rum nose, the nystagmus, the changes in their skin. They walk with a rolling gait. They have no balance. They slur their words. It's hard for them to focus. And that's because of what alcohol has been doing to their brain. And they've recovered with those links of sobriety. They've recovered about as much as they're going to recover. And recovery for some people just means no further damage because they're pretty damaged already. And this doesn't mean that they're incapable of living fulfilling lives or that they can't be happy in their lives or whatever. It means that they have damaged themselves to a point that they can't recover any further physically than where they are. And that's kind of a sad statement, but it's a true statement nevertheless. The physiological changes that occur with alcohol or other drug use, some other drug use too, is not something that lends itself well to reversing. I have something else I want to say about that, but I forgot it already. Okay, if it recurs to me, I'll tell you. Hepatic or portosystemic encephalopathy is associated to liver disease, toxins that the liver is unable to purify float around, getting the brain poisonous. And you can fall into a hepatic coma, which is liver poisoning, and you die. It can be fatal. So when we, and chronic hepatocerebral disease is a complication of long-standing liver disease, and this is, again, an organic brain disease, and that doesn't respond to treatment. Alcoholic polyneuropathy is nerve and tissue damage in other parts of the body, burning in your fingers and in your feet, tingling, itching. That's alcoholic polyneuropathy. Muscle damage occurs in like half of all people that have who are heavy drinkers, and it often occurs in tandem with the nerve damage that leads to polyneuropathy. This is treated with medication, and and sometimes it gets better, and sometimes it doesn't get better. It's real hard is on people who are in recovery because it's a painful and extremely annoying condition. And then you have vision problems such as alcohol, tobacco, amblyopia, which is diminished vision from the combination of drugs messing with potassium levels in the blood, etc. Is characterized by the onset of blurred, dim vision, and you have pain behind your eyes, difficulty reading, intolerance of bright lights, etc. This can be reversed too with thiamine treatment. Then you have subdural hematoma. Subdural hematoma is bleeding below the dural layer of the brain. And people who are chemically dependent, people who suffer from alcohol dependency, are very prone to having this condition. And through misadventure, from getting punched in the head, falling down, having car wrecks, you name it. So anytime you have a subdural hematoma, anytime you have a brain bleed, you're in a heap of trouble. The blood on the inside of the vessels in the brain aren't a problem. When the blood gets on the outside of the vessels in the brain, then there is a problem. You have the nerve in the brain, the vessels tend to constrict and tighten up when there's blood on the outside of them that reduces the flow. Maybe that's an attempt to, save your life or to reduce the bleeding. But this is occurring in a contained space. You've got a skull that holds everything in there, right? And you've got fluid that's around that brain, and the brain's kind of like gray jello, right? And if it swells, it can only swell so far, and then you'll have to look at drilling holes in the skull to allow the brain to, or taking part of the skull off to allow the brain to swell, and hope that it doesn't get infected and die in the process. But anytime you have a brain bleed, and you have a chance for a condition known as anoxia to occur. And when anoxia occurs, anoxia is pervasive cell death due to loss of oxygen. And so if your brain swells, even though there's a bleed in a specific area of it, if it makes the brain swell, then that pressure is going to be kind of universal around the whole brain. And so the damage to areas clear on the other side of the hemisphere from where the bleed occurred can be a problem. Treatment generally, if you have a subdural hematoma, is surgery, taking out the blood clot, and hoping that that takes care of it. You have miscellaneous CNS disturbances that are associated with alcohol and other drug use. Bacterial meningitis, seizures following head trauma. And remember, drinking is a head trauma. You can drink yourselves into epilepsy. Concussive syndrome, strokes, subarachnoid hemorrhages. All of these are possible or risk are outcomes to heavy drinking. And alcohol is a risk factor in the development of all of these. Over time, neuropsychological impairment occurs. Drinking does make you stupid. The more you do it over time, you lose IQ. You are not as sharp as you used to be, so that over time you kind of lose it. Over time you kind of lose it anyway, but if you drink heavily, you lose it faster. It accelerates the process into organic brain dysfunction. There are miscellaneous effects that happens too. Hodgkin's disease, lymphatic cancer, is exacerbated by alcohol use. Familial tremor, something that runs in families, is and can occur in relatively young people or exacerbated by alcohol use. Chronic fatigue syndrome runs in families with alcohol use. Is associated with a variety of metabolic disorders over on page 179, including hyperuricemia, which is elevated uric acid, diminished potassium levels, decreased magnesium levels, metabolic acidosis, decreased levels of calcium and phosphate, increased postoperative complications. If you're a drinker and you are a smoker, look at the stuff that happens to you if you have to get an operation. Infections, cardiopulmonary problems, excessive bleeding, they're all related to the combination of factors that occur when you drink and smoke, particularly in combination. You know what? You don't even have to be a heavy drinker. You just have to be a drinker to get that. Now, sleep and sleep disturbances. This is a big deal when you're working with chemically dependent people. Lots of folks who have chemical dependency claim that they cannot sleep. When they're if they don't have something to drink, and they're probably right. They've lost the ability to do that. They've drunk themselves to sleep. We've already discussed, but I want to reiterate that if you drink enough to pass out, passing out is not normal sleep. Passing out is going into an alcoholic coma. You put enough of a chemical into your body to go into a pre-anesthetic state. So there's nothing normal, nothing even remotely similar to normal sleep with passing out. And passing out does not mean forgetting stuff. That's blacking out. People confuse the two all the time. When you drink yourself to sleep every night, your sleep isn't normal, and you shoot right through REM sleep sometimes, so that you go to bed and you sleep. And if you put a camera up on someone who passes out, you'll be and videotape that. You'll see that it's not a normal sleep. After a period, they'll lay there like a lump for a little while. Then after a period of time, they may start shaking and twitching. And then they'll jerk a little bit and turn over and kick their legs about and turn over some more. And now it's starting to look like a really aerobic sleeping exercise because of the psychomotor agitation that they're going through as the alcohol dosage wears off and they're moving up to a state of consciousness again. So when they wake up, they're tired. They didn't rest well. They didn't go through the normal 4 stages of sleep. And if you watch people when they go to sleep, they don't do it gradually. When you go to sleep, it's like turning off a light switch. It's you may lay there drowsy and feeling sleepy and about to doze off, but when you hit it, when you go to sleep, it's like hitting a switch, and you go to sleep. And start moving through the sleep stages. But if you're intoxicated, you don't move through the sleep stages normally. And one of the stages that is most disrupted while you're through drinking is REM, rapid eye movement, or dream sleep. So REM sleep is you don't get it. So a complaint that you'll have from people in recovery, early recovery, is I can't sleep, I can't go to sleep, I need something to help me go to sleep at night because I can't do it, and I can't stay asleep. I keep waking up, so I need some help here. That's one. Another one is, oh my God, the dreams I'm having. I think I'm going crazy. I'm having these horrible dreams, and I'm doing terrible things to people. I think I may be, like a psycho killer or something. You got to help me. Well, what's happened is that you've suppressed your REM sleep for a very long time, and now it's coming back to you, and it's coming back in spades because of that rebound effect. Remember we talked about that? When you take a drug that causes you to go one way, when you stop taking it, you go the other, and sometimes you go way far the other way, and that's what's going on with a return to REM sleep. And you really don't necessarily need a psychiatrist because you're having vivid dreams. That occurs. And part of the things that we do when we dream is we kind of handle difficulties that we may be having in life. I dream about things that are on my mind that worry me. So I'm still with them. They're still with me when I'm asleep. I'm trying to work through them in a way. It's what Freud and Adler and a bunch of other people have had to say about it, right? But alcohol messes with all the neurotransmitters that are involved, so that my sleep is super unnatural, and it's not what it should be. So here I am, and I'm having these vivid dreams that when I do go, sometimes I don't want to go to sleep because I don't want to dream what I'm going to dream, and I've got stress, I've got neurotransmitters that are out of whack, I've got rebound effects going on, but it feels to me like I'm crazy. If I take sleeping pills, that's a bummer, because the more pills I take, the more I need to take to be able to sleep, to get to sleep 15 minutes sooner and stay awake 45 minutes longer, stay asleep 45 minutes longer during the night. One of the dreams that bothers people, particularly in early recovery most, are slip dreams. And if people are having them, don't take them lightly. You may need to console these people and reassure them that they haven't done anything wrong, they have nothing to be guilty about, because the dreams are so real. We think we've done something when we haven't, and they're frightening. The thing that I think is, the slip dream means that I want to get high again. The slip dream means that I'm gonna get high again, and it doesn't. It doesn't mean that you're going to get high again. It doesn't even mean that you want to get high again. What it means is you're having dreams about things you're afraid of and things that worry you, and getting high is one of them. So that's how that goes. Insomnia. Boy, I like to talk about this with clients. If you're an insomniac and you come into my office and you say, Howard, I can't sleep, I don't know what's wrong with me. And I said, well, let's talk about it. Let's see what's going on that you can't sleep. Well, I don't have a job, so I sleep late in the day. I go to sleep about 4 o'clock in the morning, and I sleep till about 10. Then I get up and drink some coffee, have a few cigarettes, take a shower, go to a noon meeting, drink some coffee, eat some cookies, stuff like that, hang around the club for a while, go have some lunch about 2 o'clock, take a nap, get up around 4, drink some coffee, smoke some more cigarettes, go to a 6 o'clock meeting, go to 8 o'clock meeting, go to a 10 o'clock meeting, and then have dinner after that, and hang around at Denny's with my buds till about 2 or 3 in the morning, then go home and try to go to sleep. And I can't go to sleep. Well, duh, go figure. Here's some things that you can do if you have trouble sleeping, and this is Howard's free advice. You can get this for nothing right here. Stop drinking coffee all day long and caffeinated beverages and colas and that kind of thing. They're okay to drink in the morning. They're even okay to drink in the afternoon and night, unless you have insomnia issues. I like a nap in the afternoon. If I can catch time to do it, a 30, 45-minute nap does me all the good in the world if I can arrange that, if I have time to do it. But I don't have insomnia. I usually, I say I don't. My normal cycle is I sleep about 5.5 hours a night, and then I have an afternoon nap. That's about what I do. And it doesn't, is not a problem for me. But if it were, I'd cut out the coffee. Stop smoking cigarettes. Quit eating sugar. There's a great line in Clean and Sober, a film that came out in the late 80s, maybe early 90s. I don't quite remember. And one of the characters meets his sponsor at a restaurant similar to Denny's, and the guy is sitting there and he's scarfing down a piece of pie, and there are these ice cream float glasses, the big, I don't know what they're called, ice cream float glasses, 4 or 5 of them sitting on the table, and the waitress comes by and he indicates he wants another one, and so she nods and goes off to get it. And Michael Keaton, he was the character, the star of Clean and Sober, he walks in and he looks at this guy, Emmett Walsh, and says, "What the is it with you people and food?" And so the guy who's in recovery, the drinker, has totally gone compulsive on sugar, processed sugar, caffeine, and stuff like that, which is common as dirt in the recovering community. And more alarming to me, anyway, as I see more and more people who are in recovery, and I'm making air quotes with my fingers, who are running around drinking these triple caffeinated energy drinks. I mean, it's speed for wusses. But anyway, the insomnia is a real deal. If you go to bed at night, don't go to bed till you're sleepy. It does you no good, to try to go to bed at 10 o'clock just because you think you're supposed to go to bed at 10 o'clock. Stay awake until you're sleepy. Don't drink coffee. Don't smoke a lot of cigarettes. Don't eat a lot of cookies and sugar and stuff like that. Try to not ingest that kind of stuff. When you get sleepy, go to bed. Lay there 15 minutes. If you don't go to sleep, get up. Go do something else till you're sleepy again. And if you don't go to sleep that time, get up again. It's like that thing with the erectile dysfunction. The minute you're thinking, "Oh my God, I hope I don't," then you won't. Don't make the pillow your enemy, something that you need to overcome. You can't make yourself go to sleep. So get up and then go back to bed when you're tired again. And it may cost you a couple of nights' sleep, but after a while you'll get into a rhythm. And don't sleep late in the morning. Get up. Get up at the same time every day. Don't sleep in on the weekends. Don't take daytime naps. And this is if you have trouble falling asleep at night. I'm not saying that you can't sleep in the week on the weekends otherwise, or that you can't take a daytime nap otherwise. But if you have problem going to sleep at night, you need to avoid doing those things. And then you'll be able to eventually keep to the regimen, and you'll train yourself to do this. Blackouts in memory. Blackouts are retrograde amnesia episodes. It's the effect of alcohol on your neurons. It interferes with both your short and your long-term memory. A blackout is present inability to recall something that happened to you while you was drinking, or something that you did while you were drinking. I got home, somehow I woke up in my bed, I don't know where I was last night after about 10 o'clock. I didn't get home, my mom said, till about 4 in the morning, but I don't remember where I was. And I went outside this morning and I look at my car and it looks like, it's been tricked out for guerrilla warfare. It's got mud and weeds and bushes all over it. I look at it and make sure there's no blood or human body parts there up under the frame. But, I don't remember getting home. I don't know how I got there. I don't know who I was with. I don't know where I had been. And I play this off as a normal thing. Kiddos, it's not a normal thing. Normal people do not get that drunk. They do not get so loaded that they can't remember what they did, and then they continue to function for hours after they're in that state, and tomorrow they can't remember anything about it. Blackouts are real. Now, I don't doubt for a minute that some evil-intended people will do mean shit to you and then tell you, well, I was drunk, I don't remember it. Well, maybe they don't. But even then, if they don't remember it, didn't mean they didn't do it, did it? So then you have grayouts or brownouts where you remember some things, not quite sure about them. I've got a lot of those. I'm not real sure if this is actual memory or if someone told it to me, described something to me, told me about something I did while I was drinking. I don't know. But blackouts are retrograde amnesia. And I've heard it theorized that if you drink enough to get back to where you were when you had this experience, then you could remember it. But I don't want to remember it that bad. So, the blackouts may be total blackouts or they may be partial blackouts. You may forget part of a day or whatever, but you just don't remember what you were doing while you were drinking. Alcohol has that effect on memories. And if you, I think this falls under the heading of more will be disclosed to us as we're prepared to handle it in the big book. I don't know if I'd want everything flooding back at me and living Technicolor and things like that. Blackouts are kind of individualized. Some people have them all the time. Some people have them every once in a while. Some people have them sporadically, in shorter periods of time between, and other people just only occasionally. But blackouts occur in non-dependent individuals too under certain circumstances. When I first got into this field in 1985 and started doing this sort of thing, working with people and learning how to be a counselor, and I had, again, one of my mentors told me that once you ascertain that folks are having blackouts, that's it, brother. That's all you need. It's like that. It's like that physical dependency. If someone's having a blackout, they're addicted, because normal people don't have it. Well, normal people can have, but and I say that with a reservation because a blackout is an abnormal response to alcohol. So if you have an abnormality, then it's an abnormality, right? But it doesn't necessarily, one blackout does not an alcoholic make. People who continue to drink, and Jelinek spoke of that too. He focused on blackouts as being early manifestations of the disease, as being key indicators of the prodromal phase, which is the disease signaling. But thinking has changed a bit about that. So one blackout, like one DWI, doesn't make you chemically dependent. It means you might have a problem, I usually talk about this in the family section, but my mother's oldest brother was murdered by his best friend, actually. They had a disagreement over a woman, and the best friend beat Bill to death with a hammer, and in court he claimed he didn't remember. He was full of remorse. He believed he did it, but he didn't remember it. But it was still, enough to get him a sentence in Alabama, and he stayed a long, long time in prison for that. But there are all kinds of different theories for how these things occur. And I'm not trying to make neuroscientists out of you, but you can research that if you want to. One of my favorites is there's two kinds of filing systems. It's like saving something on your computer under sober and under drunk. You can access the sober stuff pretty that you put in sober pretty easily, and you can access the stuff that you put in sober while you're drunk. It's just real hard to access any of the stuff from the drunk folder when you're not drunk. So withdrawal syndromes, we talked about that a little bit. Physiological withdrawal, when you stop taking a drug and you suddenly have physical symptoms because of that. And the abstinence period begins within a certain period of time after you've last done the drug. If you're a heroin addict and you take your last shot of heroin tonight at 10 o'clock, you're thinking, what have I got to do in the morning? Because I'm going to sit here and I'm going to enjoy this a little bit, and then I'm going to go to sleep. But what am I going to do in the morning? Because I've got like 12 hours before I'm going to start feeling really crummy, if that long. And I'm going to start feeling bad, and it's going to be terrible. So I got to start hustling the minute I get out of bed. And that's a negative reinforcer, trying to avoid the sick. Well, with alcoholics, they don't have DTs and withdrawal syndrome while they're under the influence of the drug, just like heroin addicts. Their detoxification begins within a period of time after they've taken the drug. And one of the first symptomologies that they experience is hyperarousal, also known as the shakes. They have tachycardia, which is a rapid heartbeat, insomnia, loss of appetite, not feeling well, being irritable, and having peripheral tremors. Your hands shake, your body shakes, your eyeballs jump behind your eyelids. And alcoholic people will have a morning drink to stave that off. And you fall into a habit of dosing regularly to keep off the physical symptoms of withdrawal. This is a key indicate of chemical dependency. You raise the blood alcohol content so you won't feel what it feels like when the blood alcohol content drops, and you begin to experience the hyperarousal. And through the hyperarousal, you move into what's called delirium tremens, or also known as the rum fits or the horrors. That's where you find alcoholic hallucinosis. And this occurs in about 25% of those withdrawing from alcohol. It's usually seen within the first 24 hours. Hallucinations. You hear things, you see things, you feel things, you smell things. You may be oriented to person, place, and time, but you have horrible nightmares when you try to go to sleep. Also probably from a rebound syndrome. Hallucinosis is not particularly dangerous in itself, but is indicative of other things that are coming usually. And that other thing that's coming is convulsive seizures and delirium tremens. alcoholics will often, who have chronic physical addiction to the disease, will often die and having heart attacks while, and seizures coming from withdrawal. I might stop to do a little bit of a warning here for people who are going into this field. Chances of you getting through a career without experiencing someone flopping in your group or in your office are kind of slim, because we're going to have people who don't take medicine to control their seizures, who don't believe that they need it, or who've never had a seizure before, etc., who will, have, and sometimes they have seizures that we don't recognize. Let me do this again, and I'll try to do this without being too overly dramatic. But you may have people who will suddenly stare off into space and then just pick it up again. And we don't know we've been gone, except other people are looking at us like, what? That's a seizure, a petit mal seizure. You may have people do, or that's a petit mal seizure. They're not just making a face at you, they're picking at their clothes, they're tugging at their hair, pulling at their beard, rubbing their noses uncontrollably. Those are little seizures too. That they're holding and throw it and jerk. The people who are having this experience, they don't always know they're having this experience. It's just happened, and we didn't know what. We didn't know, but people are looking at us, and it's kind of crazy, right? Or we may fall. And if someone is having a seizure, FYI, kind of keep them in the middle of the room if you can, and support their head. Don't let them beat their head on the ground or up against anything else. Keep them away from the edges of desks and things so they can't kick or flop and hurt themselves. Don't try to do anything to their mouths. It's humanly impossible to swallow your tongue. You cannot swallow your tongue unless someone removes it and pokes it back in your mouth, right? Your tongue can fall over your airway, but if you put your hand there and go, it clears. People will chew their tongues, and they tend to not do that. If you try to put something in their mouth, like your fingers, your friends may be calling you nubbin. So you want to avoid doing that, and just make them comfortable. And they may come out of it disoriented, embarrassed, because this has happened. Sometimes they urinate, and no one likes to wet themselves. So just be as patient and as consoling as you can. Don't make great big deals out of it. But it depending on the circumstance, you can't cut people loose and let them go out in the parking lot and drive away. So that's another concern with people who are. Let me see. I'm trying to get over here to another screen and see if I can look at something else. But it's not going to work for me, huh? All right, be that way. Go back to my other screen then. Looks like someone came into my office out there. Wouldn't know about that. So delirium tremens and seizures happens. Delirium tremens are dangerous, by the way. Remember that alcohol addiction is addiction to a substance that is dangerous, and because it's a central nervous system depressant. And central nervous system depressant withdrawals can prove fatal for people. So if you have someone who's going through that, it's a dangerous situation. I'm looking at the wrong thing again. Country music writes songs about these, like green snakes on the ceiling. And then you have coke bugs that are, now what? Looks like a computer glitch, doesn't it, guys? Well, stop. Click to sign in. I got to sign in again. It looks like I do. I'm not a robot. Have I been on here too long with you guys? How long have we been doing this? Okay, there we are. Me and computers, we fight sometimes. Long story short, 1 in 5 people who are chronically addicted to alcohol will die in delirium tremens. And that's pretty unique among the drugs. Where the withdrawal itself will kill you. Late withdrawal phenomenon. I know a little bit about that too, because I suffered from it somewhat when I cleaned up, and I shook. I was irritable. I couldn't sleep, and all of this is, over a month after I quit drinking, and I was trying to find a job, and I'm a welder, right? And just between you and me and a fence post, and it's hard for me to do this without being able to show you what's happening. Oh, what is happening? Well, display capture, how about that? I don't know what happened, guys. The camera's off. But nobody wants to hire a shaky welder. So that's the bottom line on that. I don't know if I got you back in. I didn't. Okay, I'm hoping this works now. Protracted abstinence syndrome. It was hard for me to not be able to pass a welding test because I was shaking, when I knew that if I had 2 or 3 Budweisers, I could go in there and my hand would be steady as the Rock of Gibraltar. So it was hard during that particular period of time to stay sober and get to the other side. Not every withdrawing patient needs hospitalization, but every withdrawing patient needs to be medically supervised. Long time ago, back in the late 80s, a woman went to the Wheelhouse in Deer Park, and I'm still not going to show you. We're just going to have to look at a blank screen. Went to the Wheelhouse in not the Wheelhouse, but the New Hope Women's Center in Deer Park. And it was her first night there, or maybe it was her second night there, I don't recall. But she went to meetings and she wasn't feeling good. And she went upstairs and she laid down. She started having seizures and the girls freaked out and they called an ambulance and stuff. But when the ambulance got there, the lady was dead, and she was dead on arrival when they got her to the hospital. And there's a big hoop-de-doo out there, and Channel 13 came out. There was a guy that used to hang around those meetings who had washed out of seminary, but he put on his black shirt and his white priest collar and said, I knew this was going to happen sooner or later. You know, you've got all of these poor women coming here, and these people don't really know what they're doing, and no one's had any medical training, and yada, yada, yada. Well, I was there, when the lady arrived, and I knew of this lady. She had burned up her insurance. She had no resources. She had a sack full of belongings, a big brown grocery sack, a paper one. And the thing I remembered is she had one of those square electric skillets that has a plug in it, right, with no lid. And that was probably the most valuable thing she had among her possessions. And the place, the facility itself, the Women's Center, was not a medical facility. They had no medical facilities. If something went on, they had to call an ambulance, take them to the doctor or whatever, and they're still doing that today. But this lady, had she not been at New Hope Women's Center, would probably have died in a ditch somewhere in Deer Park. She had no place to go. She didn't have a vehicle to sleep in. She was, and I think she was pretty lucky because she died in a place with people who were caring for her and cared about her and cared about what would happen next. So she caught a break on that one. And that's the reality of alcoholism, And when you abuse alcohol, it does things for you, it does things to you. And I understand completely what someone means if they're in a meeting and said, hi, I'm Howard, and I've been clean and sober now for 90 days. I know what Howard means. He's not been clean and sober. He's been abstinent. He's been free from using the drugs. Because I have been Howard, and I am Howard, and I know that what was going on for me for the first couple of years of recovery was hardly clean and sober. I mean, there were times I was hanging on by the skin of my teeth, and what was going on in my head couldn't properly be called thinking. So it takes a while, and sometimes a lengthy while, for you to rebound from the effects of the drugs and alcohol and for them to wear off of your system. And if you've been steady drinking every day for, 10 years or so, you're hardly clean and sober in 90 days. It's more like a year and a half where you can start thinking about I'm in the clean and sober range. But you're abstinent. And for someone who's alcohol dependent, who has an alcohol use disorder and has some chronicity to it, to stay sober 90 days is nothing short of a bona fide freaking miracle. So I'll celebrate that with you all day long. That said, I have reached the end of both my voice and my lecture, and so I will call it a night, and I'll talk to you soon. Bye.